living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Depression can happen to anyone at any age, and it is one of the most common mental illnesses in America, especially for those who are 60 years of age and older. If left untreated, depression can erode quality of life, decrease one's overall health, and in the most severe cases, it can lead to suicide. Don't shrug it off. There's help available, regardless of where you live and your income. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. Joining us today is Dr. Roman Hendrickson, a board-certified family medicine and geriatric physician. He is also a fellow of the American Academy of Family Physicians. And recently, he received the Montana Medical Association's most distinguished award for his commitment to the profession and for advocating for ongoing improvements. Welcome back to our show, Dr. Hendrickson.
Thank you.
Can you tell us what depression is and what its symptoms are?
Well, depression is sort of a constellation of symptoms. It's not any one thing. Most people think it's just when you get the boo-hoos, but really it has to reflect when people are becoming incapacitated in their daily life. It can include feelings of sadness, hopelessness, worthlessness, that can last weeks or months. Sometimes it's just people who are just not doing well. They're fatigued, they have insomnia, they're irritable, they can't focus, they have a loss of interest in activities, they start tasks and don't finish them, things start to pile up. It's just a reflection of the fact that their brain is not working at 100% anymore.
So it seems common in our culture to dismiss depression, and people misunderstand it as just being sad, and folks will tell you, just snap out of it. Can you talk about how serious it really is, and that it's more than just feeling sad?
Well, sadness is a normal emotion. It sort of provokes us to act. Unfortunately, if things get out of control, then they're out of our ability to control them. And that means you can't just wish upon yourself that you'll go back to the way you were. It's not usually a temporary, but becomes a chronic problem unless you intervene. It changes the way you look at the world. You might look at a person and say, why are you depressed? There's nothing wrong. Why are you feeling this way? But really, depression for a lot of people is the sum total of a lot of stresses that occurred, and then finally something comes along and just pushes them over the edge. Their perception of the world around them changes. They start to feel worthless. They can't understand why people feel the way they are. They feel unloved, unimportant. It takes away their ability to experience joy. They don't feel connected with their outer world. Sometimes they just cannot become happy anymore.
Why is it important to treat depression, particularly among older folks?
Well, obviously, as depression gets worse, it can lead in the ultimate to suicide. However, the presence of depression can interfere with our ability to treat other medical problems. It's well shown that if a diabetic is depressed, their diabetes is under worse control. Diabetes also affects other medical problems, and we need to control their diabetes to be able to treat someone medically. It interferes with people's ability to function in their normal work environment and in their normal social environment.
Why is it important for people to talk to their physicians about depression or the fact that they have a family history of it?
Well, obviously, people who have a family history of it may be more susceptible to developing depressive symptoms. You're not necessarily doomed to become depressed if you have a family history of it, but it's something to consider. The physician should be an entree into potential treatment for someone and diagnosis. The primary care doctor may be able to initiate treatment, And if you have a primary care physician, it should be someone that you trust and you can start discussing your concerns with.
So what about medication and drugs? So if someone is on a drug for depression, how long does it take for that medicine to take effect?
Medications, depending on the individual person and which medication you're using, some may start to have a positive benefit as soon as 1 week, but usually improvements start to show within 4 to 6 weeks.
So sometimes people with depression are taking their medicine and their drugs, they feel better and they stop taking the medicine. What happens?
The likelihood of sliding back into depression is greater if you haven't been treated for at least 6 months once you've reached remission. So in other words, you can't treat for just to the point where you're feeling better. You have to be treated to the point where you're basically not having any symptoms, that's remission, for at least 6 months before there's a consideration of tapering or discontinuing the medication.
What happens if there are side effects with the drugs?
Well, if there's side effects, then a consideration of either adjusting the dose or changing the medication. And sometimes people's perception of side effects does not necessarily go along with the reality of what's going on with the medication. It may be something else that's going on, but it should be discussed with their treating physician.
So I understand that some drugs actually cause depression, and so talk to us about those drugs.
The one that's of most concern is corticosteroids, so that's prednisone is the most commonly used one. And the higher the dose of prednisone and the longer someone's on it, the greater the likelihood that they'll become depressed. So that's a drug-induced depression, or if someone's already depressed, the cortisone may make it worse. Other drugs, such as benzodiazepines, which are like Valium, Ativan, Xanax, that we use for treating anxiety, we're not sure if it actually causes depression or it just makes it worse. Other drugs, such as muscle relaxers, beta blockers, which are drugs we use for treating hypertension, statins, and other cholesterol-lowering drugs may also increase depression.
So lots of drugs can affect depression. So stay tuned to learn how depression is diagnosed and treated. We'll be right back after this break. Welcome back. Joining us now is Dr. Kolstad, who's a licensed psychologist. Thanks for being on our show.
My
and
pleasure.
Welcome. Can you briefly explain to our viewers the different forms of depression and the traits of each?
Yes. Like all disorders, the depression exists on a spectrum. And it goes from something that's sort of mild and short-lived to something that is much more intense. So I'll start with the milder form, adjustment disorder with depression. That can happen after a significant life event. Even retirement can create an adjustment disorder with depression, or an illness or an incapacity or a loss of a loved one. That depression typically starts about anywhere from a couple weeks to a month after the event, and usually resolves within 3 months. And the symptoms are mild. There's a slight loss of interest, a little bit of sense of hopelessness, but it tends to resolve itself. The next level I would call is persistent depressive disorder, which is like a chronic low-grade fever, if you will. It is something that has been going on for almost 2 years, so it's been going on for a long time, and the individual feels down and somewhat hopeless. There's not much joy in life. They feel like withdrawing socially. Things that used to be pleasurable are no longer pleasurable, but they can still cope. And then the next level down is what is called a major depression. And that is an experience in which the individual is deeply depressed. And it is a noticeable, painful kind of experience of the individual can't think properly, so their concentration and attention are impaired. Their sense of joy and hope is impaired. They feel black and gloomy. They withdraw from social activities. Sleep is disturbed. Appetite is disturbed. That's a major depression. And probably the worst form of depression is the depression that occurs with a bipolar disorder. So that depression is experienced as just the pit of despair. And that pit of despair seems inevitable and unredeemable to the individual. And so that is probably the deepest form of depression.
So I've heard the term major and minor depression. Is that a general category for the types of depression you just talked about?
In a way, yes, but no depression feels minor. Even an adjustment disorder with depression doesn't feel minor to the individual because it's a significant change from where they were before. It can often be experienced as physical symptoms, so they just feel tired and as if they can't sort of participate in life, but it doesn't feel minor. But depression does exist on a spectrum, as I mentioned.
Is there a difference between grieving and depression?
Absolutely. Grieving can lead to a depression at times. Grief is the loss of a loved one, obviously, or the loss of something or someone significant. It typically is experienced in waves, so that after the loved one has passed, it is experienced as a wave of grief and tearfulness and despair and some hopelessness. But it often then is intermittent with periods in which the individual can come back into life. And so it's sort of a wave followed by some hopefulness and engagement in activities. Depression, however, if depression sets in, if the grief is complicated by guilt or by trauma, it can turn into a depression. And that depression then is more sustained and it doesn't resolve. The person just feels more and more hopeless each time they people try to engage them. So grief, a natural grief process will resolve itself. Depression tends not to resolve itself.
How long does the typical grieving process take?
Depends upon the person and the circumstances, but typically that intense wave of grief happens for about a year and can often get worse around significant events like anniversaries or holidays or special times with the person who's in bereavement. But it's typically about a year. And again, as I said, these waves happen and the waves get less. Tearfulness will probably continue for the next couple of years. So someone mentioning the name of the lost loved one may see that the grieving person is tearful. That's pretty normal. So tearfulness for even a couple years after is pretty normal. But generally, the individual regains some sense of hope and joy in the present life.
If I had a friend who lost someone and is grieving, and their grief is pretty significant and has lasted longer than a year, what could I do to help?
If their grief has lasted longer than a year, then I would say that it's fairly complicated grief and may be turning into depression. One of the ways that you can help your friend, first of all in dealing with the grief, is mention the name of the loved one. Mention that person's name, because the grieving person often just wants to hear that somebody remembers that individual. So mention the person's name. See if that person can experience some joy in life. And if you find that they cannot, then it's time to help that person get some help. So you need to talk to your friend, and you need to make sure that you can see if it's turning into a depression.
Okay. Well, stay tuned to learn more about depression, its treatment options, and what insurance may cover. We'll be right back. Welcome back. We're continuing our discussion with Dr. Kolstad on depression. If someone thinks they have depression, should they see their primary care physician or a specialist? And how do they go about getting that clinical help?
If they think they have depression, a good place to start is their primary care physician, who might be able to refer them to a counselor or a therapist. There is a website to find local therapists, and you can find them in any town. It's called psychologytoday.com. And the therapists it's an advertising spot for therapists. And it has them describe their specialty and the kind of work that they do, and the insurance is accepted. So it's a good way to look through a grouping of a local group of therapists and pick one that they find helpful. So I'd say either the primary care doc or going to psychologytoday.com, or asking a friend who's in therapy who they would recommend, and seeing if you can get in.
How does alcohol impact those who have depression?
You know, I'm glad you asked that, because it's a bit confusing. People have heard that alcohol is a depressant. It doesn't mean that it creates depression. What it means is that it depresses the cortex, the lining of the brain that is responsible for inhibition and judgment. And so it depresses that, it slows down the central nervous system and depresses that. And so it can create impulsive actions. It can bring to the surface feelings that had not been recognized or acknowledged, like rage, like jealousy, like paranoia. And so it can make a depression much worse, because the individual acts out and then feels regret. People often use alcohol because it lowers anxiety. And so they're using it as a way to engage with others without the anxiety. So it's a coping mechanism that can go awry.
Does smoking impact depression?
Smoking is the same thing. Smoking has actually a mild antidepressant and anti-anxiety component in it. And so it feels like it alleviates the depression initially, but what happens is that the individual has less energy after smoking, may be impaired in their breathing and ability to exercise. And so the very things that you want somebody who's depressed to do, to be active, to engage with others, actually are inhibited by smoking. So it starts out as a coping mechanism, but it really ends up making the individual feel worse.
If someone had depression in the past and it resolved, can it relapse?
Yes, it's likely to relapse, actually. So the individual needs to watch out. An individual who's been depressed really never wants to go back there again. And so sometimes the initial signs of depression can lead them to feel very anxious, and that makes the depression come on more quickly. Mm. So it's important to know the warning signs and to get help quickly.
So outside of getting clinical help, what are some things people can do to cope with their depression?
The things that help are the things that a depressed person typically doesn't want to do, which are get exercise, start moving, meditate. Meditation is very helpful for depression because it focuses on the here and now as opposed to ruminating about the past or worrying about the future. Try to just start moving. If you go to your family doc, see if they can prescribe an antidepressant, which can be very helpful, although antidepressant plus therapy is much more effective than antidepressant alone. You may need to get a referral for a psychiatrist if you've been on an antidepressant that hasn't been helpful.
Let's talk about the professional treatment then. So when someone goes to a professional seeking treatment, What does that typically entail?
If the individual is going to a therapist, what it typically entails is talking, much like you and I are talking. And the therapist wants to know about the history of the depression and about how that individual came to feel that way, and sometimes their past, can make recommendations for experiences or ways of coping with depression. If the individual goes for medication to a primary care doc or a psychiatrist or an APRN, it typically is they'll talk, but it's typically about the medical alleviation of the symptoms.
Do most insurance plans cover mental health visits and treatment for depression?
Yes, they do. It's always wise, though, to check with your provider, with your insurance provider, to make sure that they cover it, but almost all of them do.
What about people that don't have insurance? Are there programs that might help them?
There are. There are community medical centers, like here in Helena, it's Peerview, and that have sliding fee scales. And there also is a website, which is findahealthcenter.hrsa.gov, that can help you find some free services. Often churches have services for individuals who are struggling as well, and those are free.
So in the minute that we have left, what would you tell our viewers about depression?
I would say that if you begin to experience hopelessness, despair, and you can't shake it off, to get help. Don't just assume it will get better. Don't brush off the symptoms. If you see in yourself a noticeable change, or in another a noticeable change, it's time to get help. Call your family doc or find a therapist.
Thank you so much, Dr. Kolstad.
My pleasure.
And thank you to Dr. Hendrickson for being on our show too. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Thanks for joining us.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.